Health leaders in the UK are raising concerns that the government is not getting the Pfizer-BioNTech vaccine out quickly enough. One of them is Dr. Richard Vautrey, the chair of the British Medical Association's General Practitioners Committee. He joins me now from Leeds. What is your concern with the distribution, the administration of this vaccine, Doctor?
Well, as you've just heard in that package, the Pfizer vaccine is much more challenging than many vaccines that we've had to handle because of the requirements for deep freezing, and then when it's defrosted, needs to be used within a very short time frame. That puts limitations on how it can be delivered. And we're very used to, in the UK, providing big vaccination programs. We've just completed a massive flu vaccination program, but that's through every practice within the UK giving the vaccine directly to their patients. So we want to be able to do that, and hopefully we will be able to do that with the Oxford vaccine that is hopefully going to be approved very soon.
That was going to be my follow-up. The Oxford AstraZeneca vaccine does not require that intense level of refrigeration that the Pfizer-BioNTech vaccine demands. So hopefully this will mean what, as far as you're concerned, that this vaccination program can take place in GPs' offices, medical centers, that kind of thing, instead of specialized hospitals?
Yes, we have seen many hundreds of thousands now of vaccines given by GP practices in the community using the Pfizer vaccine, but that's been a huge task for them to do that. But we would hope that the Oxford vaccine, once approved, will enable a step change in the vaccination program. We want to protect our vulnerable patients as quickly as possible, and by having a more flexible vaccine in each and every centre, that will enable us to do that very soon.
Okay, but that being said, even if vaccinations take place at, let's say, 1 million a week, you're still looking at months and months before this country, and it's a similar picture in other countries around the world for our viewers watching us from elsewhere, reaches that critical mass level of vaccination so that we can go back to living a normal life, correct?
Yes, that's true. And I think particularly we have to remember that we have to give 2 vaccines to every patient for them to get the maximum protection. So providing large numbers of the most vulnerable patients in January with a vaccination, we'll need to do it all over again in February to ensure that they get the maximum protection from this deadly infection.
But they're still somewhat protected after 1 jab, right? Which is better than nothing.
Yes, indeed. And I think it's really important that we give people who are most vulnerable, particularly those in their 80s and 90s, the vaccination as quickly as possible. That first vaccination will give them some degree of protection, but to get the full benefit, we need to give people 2 vaccinations. And at the moment, we're doing that with the Pfizer vaccine. And so those who've had the Pfizer vaccine already in the UK, that's over 500,000 people, will need to have a second dose in the coming days. And those who continue to get the Pfizer vaccine will need to have a repeat vaccination. So we'll continue to have those challenges of the storage and the distribution of that particular vaccine for the foreseeable future. But hopefully having more sites offering more vaccine more quickly will enable us to get on top of this vaccine, on top of this pandemic, just that bit quicker. But this is going to be a mammoth task for everyone working in the NHS, and we will need the support of everyone to enable us to deliver this vaccination program.
Dr. Vautrey, one quick last one. Why are the numbers so atrocious right now in the UK? More hospitalizations today, today is December 28th, than at the peak in April. What's happening?
I think what we're seeing is the expected increase within the winter period. We know that during the winter, people are more likely to contract the infection in household groupings, people meeting indoors, whereas previously during the summer, people were more likely to be outside and thereby less likely to contract the infection. We also have a new variant of the coronavirus circulating, which is more infectious, spreads more quickly, and it's inevitable. So in those situations that more people will contract this infection. We do need to limit the spread by limiting the social contact of people with one another. That's very hard when people have been trying to do that for many, many months. But we're not out of this pandemic yet. We need to maintain our guard. We need to continue social distancing, and we need to continue that for the next few months at the very least.
Yeah, another few months of alone time, lots of alone time, but it's for the greater good. Thanks very much, Dr. Richard Vautrey of the British Medical Association. We appreciate you joining us.